Good morning, everyone. My name is Nicole Howell. I'm the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda. And I want to thank all of you for making the time to be here on New Year's Eve of 2020 as we prepare to go into the next year. We are here today to hear from Dr. Levin from Contra Costa Health Services, one of our Deputy Health Officers, as well as our John Muir team about what they are preparing to do to launch COVID-19 vaccine clinics in residential care facilities for the elderly. So again, I want to encourage you today to drop your questions and be mindful of the chat. We're going to be leaving resources there. So please go ahead and feel free to add questions there or in the Q&A. We will do our best to get to them. Today's webinar is being recorded and we will share it with you probably early tomorrow so you can go back and rewatch the training. So with that, I'm going to go ahead and turn it over to Dr. Levin. Dr. Levin, thank you so much.
Thanks, Nicole. Good morning, everybody. Thank you for making it here today so that we could give you a little bit of information about the logistics of what we are partnering as Contra Costa Health Services with John Muir to try and expedite your ability to get access to the COVID-19 vaccination program. So I know that all of your facilities have been enrolled in the federal pharmacy partnership program, and that program has started to roll out to our skilled nursing facilities, but they will not start the Part B of the program, which is the residential care facilities for the elderly, until the middle of this month, and it's not totally clear when exactly they will start actually scheduling the clinics. And so in light of that, given how affected the people, both the staff and the residents in your facilities are, we felt Contra Costa Health Services and with our hospital partners that it was so important that we do everything we can to get you vaccinated and get you the vaccines and the opportunity to be protected from COVID-19 as soon as possible. So our leadership teams have been working closely with John Muir and with some of our other healthcare partners in the community to figure out how we can deploy teams to come on site to facilities and deliver vaccines. As you know, I think the two vaccines that have been approved are the Pfizer vaccine and the Moderna vaccine. And we will be using the Pfizer vaccine for this program, which does require 2 doses 3 weeks apart. So what we'd like to do today is really sort of just give you a better overview of what the logistics will look like in order for us to be able to do this in the most efficient way possible, such that you can register any of your residents and your staff at your facilities who would be interested in receiving this vaccine on the day and time when the John Muir team is able to come out and deliver it. We did have a pilot with the first facility yesterday that went very well. And so we're very excited to figure out how we do this in partnership over the next couple weeks with all of you. So I'm going to turn it over now to Judy Bartlett, who is the John Muir point person that will give you some education on how it will look for you to register for your clinic appointments for the vaccine administration. Thank you.
Thank you, Dr. Levin. I'm Judy Bartlett. I am the Associate Vice President of Application Delivery here at John Muir and responsible for the technology piece. And as Dr. Levin mentioned, this is a new thing for us. We just sort of heard about this and partnered with the county this week in order to kick off this program. So we had a very quick turnaround and we're learning as we go. Yesterday we had our first site go up and administer a vaccine for residents and staff at that facility, and it went very, very well. We have partnered with the county and the state to use a tool that they are currently using in order to register individuals. What we did for yesterday's pilot was to do the front-end paperwork ourselves. However, on a go forward, it's probably much more efficient for us, as well as easier for you to register your folks yourself. I'm going to share my screen here. I hope, or Chelsea, if you have the screenshots, we can do that either. So let me make sure I can do that. And you give me a thumbs up if you can.
We see it, Judy. We got it.
Okay. So the tool we're going to be using is PrepMod, and once your facility is set up in the system, we would send you out a link that you would be able to access the application from. And this is just a screenshot of the first screen, and whether you're a staff person or a resident, we would capture a registration for each individual. It's real basic information, straightforward demographic information that we're looking for. Once we collect first, last, middle initial, mother's maiden name, race, ethnicity, this is optional, date of birth, gender, email address, and the email address is going to be important for us if we want to send reminders for your second vaccine. Phone number, address, that is the first screen. Pretty straightforward information. Next screen is regarding insurance information. The option of no insurance is also available. These are the screening questions, and if you are going to be registering your residents and don't know this information, you have the option to check I don't know. For the first go round, you'll see that you select the first shot. If you select I don't know, it won't prevent you from completing the registration. We also go through these screening questions on site as well, so they'll be asked again. And I understand that these, since we're doing it right now, they'll probably be the same, but these have changed as the requirements and the recommendations from the CDC change. So dynamic little process here. The next screen you come to, you'll see up at the top, we're going to be using the Pfizer vaccine, as he said. Each person that gets the vaccine will receive a fact sheet. We'll have those on site. Then if you are registering other individuals, not yourself, you would click on type my full name. You would type your name. Down here, you would have the choice of selecting other. Again, type your name. We do have folks sign a consent form at the time they receive the vaccine, so we've got all that paperwork covered on the back end side, but that's pretty much it as far as what we're requiring up front. Pretty straightforward information, not real complicated. And again, when we come on site to do the injections and when you check in, we review the information to make sure we've got everything accurate. Have you sign the consent form? We provide the documentation for the fact sheet, and that's pretty much the process.
I want to just pause for a question here because it relates closely to consent, which is, you know, many of the residents in these long-term care facilities are folks who experience dementia. And so I want to make sure that the facilities are aware of how they should handle consent for those individuals. So for example, would they have the form in advance so that they can make sure that the responsible party signs? Is it okay if it's, you know, sent and signed and scanned back to them? Or could they use the existing consents that they have already obtained through the pharmacy partnership and use that as a consent?
So the consent, the form that you will receive the day you show up, right? The day we're on site, that will be a consent that we will have everyone sign. Now for the dementia patients, I have a question out to our general counsel for this, and he's taken a look at all the forms that we're using. Again, this has been a really fast thing for us, so we're trying to pull all the parts and pieces together. So I'll have to get back to folks on what we're going to do about the consent for the dementia.
And I just want to add to that. In general, us as Contra Costa Health Services in the state are not requiring any written consent form. I know the pharmacy program has sent that out, but as long as we have a verbal consent through your regular channels, as you do whenever you have to get consent for any type of treatment for any of your patients that experience dementia and they have a DPOA, and it's documented in the chart, that will be sufficient and from our standpoint. So it's just that John Muir needs to figure out if they need to have something more than that. Okay.
Correct.
Thank you, Judy. Feel free to continue. I apologize.
No worries, no worries. So I see someone posted in the chat, when will John Muir be sending out clinic dates? Crystal Hapgood is also on the line. Crystal is from John Muir as well, and her and I just are connecting. Crystal sent me an email last night. I sent her one this morning, and we have not had a chance to sync up yet. As we mentioned, we just had our first pilot yesterday, so we're trying to pull together and decide on a go forward what our strategy is going to be, dates and availability and so forth, and coordination of timing. So I don't have a sense of when we're going to schedule our next dates, but Crystal, I'm not sure if you do yet or not.
I wish I had a more solid answer. As everyone knows, today is New Year's Eve, and with New Year's Day, we're running into a couple scheduling conflicts to bring our team together to first figure out who the team will be exactly going out to these facilities to administer vaccines. So we're building that team. Yesterday's team was a large team because it was the pilot, and we are trying to make sure that we can have a steady team so that we can service all of your buildings for the first and second shot. So we will have more information, I'm sure, after Monday, but we have a list of all of the facilities that we are assigned to. You all should be participating today in this call, hopefully. So you will receive some outreach, hopefully starting by the mid next week to confirm dates.
And we have a question here, which is just basically concerning that, confirming that John Muir will be giving both rounds of vaccine. There, of course, you're going to come do the first. You're going to do half the staff and half the residents. You're going to come back again and give the second round, and then start with the second group of folks. And just want to, we had talked yesterday that this is intended for paid and unpaid caregivers as well. So, Judy, can you speak to that a little bit?
So I know the county is really guiding us as to which facilities and who's included and so forth. And I understand yesterday we did residents as well as staff. I don't know whether they were paid or unpaid. It's that facility's staff. And I know, Crystal, you were on site yesterday. I don't know if you have any additional information about that.
I do. So a lot of this is tied to being prepared for on your date. We need all of your staff and residents to be registered. If they are not registered, we will not be prepared with vaccines. And the way that the vaccines work is we have to make sure that they're kept at a certain temperature. Once the vaccine is reconstituted, it is good for 2 hours. Once it's drawn up in that syringe, it's only good for an hour. So we have to make sure from a pharmacy perspective that we are prepared and we don't have extra vaccine. We also want to make sure that we have enough vaccine. There were a few staff members who weren't registered yesterday that we actually had to turn away. And that is not, we don't want to say no, we want to say yes. We are actually very excited that everyone was excited to receive the vaccine yesterday. So that was a positive, even though we were short about 5 of them. So everything that Judy is going over with the pre-registration is very important. If you're not in the system, we're not going to be able to give you that vaccine. Even though we don't have dates right now, we do have the ability to start getting you registered right now today. So if you can start compiling those line lists of your residents and of your staff, whether they are paid or unpaid, please make sure that you start on that after Judy gives you all of the information, of course. Another thing is some of your residents may have private duty caregivers. We are extending this out to those private duty caregivers, which are not part of your staff and paid by you, but they just have to be registered. So just make sure you, I'll say it again, register everyone.
Yeah, we can't emphasize the registration enough. It makes it very, very difficult because of the way the vaccine is kept and stored and reconstituted and so forth, to make sure that we are allowing enough to be on site. In fact, yesterday we had to go back to the hospital to get some, which isn't always going to be convenient and the case for us to do. So it's really, really, really important to register everybody.
I do want to make one point, though, about unpaid staff. Unfortunately, at this moment, we are not able to extend this program out to the community. So family members of your staff or family members of residents who are not direct caregivers will not be able to participate at this time, but we're all working on moving towards that. It's just, this is for this particular phase of caregivers, residents, vulnerable populations that we are serving.
This is Dr. Levin again, there is a question about folks like salon services, families visiting hospice, and on-site PT services. All those should be included. You should think of it as anyone who is part of the regular testing that we consider to be, part of regularly on-site at your facility.
And I just want to add that this is irrespective of where the resident has their insurance coverage. So if they're with Kaiser or another network, it doesn't matter. John Muir simply is stepping up as good citizens in our community and saying, we have the ability to do this, and it will be delivered however someone is insured or is not insured. So please know that is not an important caveat to receive this vaccine. So Judy, I think you talked a little bit about this, which is sort of, when are you going to start scheduling clinics? And it sounds like you and Crystal are going to connect, but in general, as these facilities are sort of thinking, do I go with the pharmacy partnership? Do I go with this? What is a general rule of thumb of when they think they would be contacted? Is it, next week, or just a general sense of that?
So Crystal, and you can jump in here anytime, John Muir is very excited about this, and we have really jumped in both feet in trying to get all of our employees, staff, physicians, volunteers on site at John Muir vaccinated. And our goal was to get us all vaccinated before the end of the year. And I think we've done a really, really good job in just the 2 weeks that we've been doing this towards that goal. So we want to get as many people vaccinated sooner rather than later, because that just benefits the entire community, regardless of which facility they are living. And it's a matter of coordinating the resources in order to bring on site to administer the vaccine, and coordinating with you all in order to get folks registered. And I don't yet have a sense of the dates, but I know in just our brief conversations yesterday at the mini meetings I was attending, they want to move forward quickly with this. And I don't know if you have specifics, Crystal, but I think by early next week, we should be able to get some dates out there.
Most definitely. I'm confident that we might even be able to start by the end of next week. We, like you said, Judy, so many people at John Muir are so excited to jump in and help. As some of you know, some of us have helped with even swabbing COVID, doing your COVID swabbing in the past, and not everyone was so excited about that. But this, on the other hand, is such a positive thing that we have volunteers who are stepping up. So I am confident that we will be able to start by the end of next week. I do know that Tosan Boyo, one of our chief operators, is looking at really really opening up the dates starting on the 11th, because we are starting the second dose for our hospital employees on Monday, or maybe it already has started. So we have a lot of things that are kind of up in the air. I love the building the plane while we're flying it analogy, because it's very true. So this is more of just an informational session, right? And to help you start pre-registering your residents and your staff. I know there was a question in the chat from Joseph V about family members of independent residents. We really do, that's a very blurry line. So I want to make sure that when we say your unpaid staff, we do mean private duty caregivers who are employed by another agency. It's not just family members, but I'm sure we'll cover more of that as we get closer. But yes, look forward to at least initial phone calls by the end of next week. We're hoping to start our clinics by the end of next week and really get them going the week of the 11th. I don't think any of the RCFEs even have dates for their initial vaccine from Walgreens or CVS. So this should be, we are doing this ahead of schedule.
And so just to talk about it, some of these facilities, they actually do have nurses on staff, and their question is, how can they be of support to you when these clinics are happening? Are those nurses able to assist? And can you speak to what supplies are brought? So for example, I know that you have the red bag and you do the monitoring. So can you speak to that? Could you maybe also add, what additional supplies should they have available? Tables, chairs, staff resources?
I can speak to that, Judy. So yesterday we gave 162 vaccines. We started at 8 o'clock, we ended at 2. We did about 30 an hour. And we set up 5 vaccine stations. We can provide our own PPE for our staff. So that would include masks, face shields, and gloves. But and then we're also going to bring all of the vaccine supplies. So the syringes and the vaccine, of course, and then our sharps containers. I will be putting together kind of a list of supplies that you can help us with. And that might be things like Band-Aids, and then maybe alcohol swabs. And these are things that you should have at your RCFE. But we're not going to expect you to provide anything that you wouldn't already have. Personnel, we could use personnel help on the day of the vaccine. We will need a couple greeters to help people go from their room, bring them to the registration table, and then help them to the vaccine station, and then to the checkout table. We will need an area of observation where the residents and the staff can sit for about 15 to 30 minutes to make sure that they don't have any adverse reactions. Yesterday, we had 2 adverse reactions out of 162 vaccines. One gentleman passed out about 15 minutes after administration. So we luckily had him sitting down in the observation area during his 15 minutes, and we were able to help him after he passed out, poor thing. So we will need personnel there to help monitor residents, and observation just means if anything should happen, you can come and get one of us nurses or a physician. We're hoping to have a physician on, we will have a physician on site so that if we do need to use any of our adverse reaction medication, they're there to help administer and do the ordering. So I promised you yesterday it was very organized. We are still in the middle of reviewing our process successes and fallouts. We will put together a needs list for you. Another best practice that we did was when we knew we were going, when we knew the vaccine clinic was going to be on Wednesday, a couple of us made a couple trips to the RCFE on Tuesday to make sure we knew the layout, we could review what tables and chairs were needed, where the registration table was, the checkout table. So we are in the middle of putting that entire process from start to finish on paper for you so that you will have it and you will be able to be as organized as we need you to be.
So Crystal, just to confirm, you're going to have things like EpiPens, you're going to handle the post monitoring, like that piece is going to be taken care of.
So we will have a kit with us that is for adverse reactions. It's kind of a toolkit. So yesterday, the second adverse reaction was someone who was short of breath. We had a team of 2 nurses, a physician, and the pharmacist all rush over to the resident who was having some shortness of breath. We were able to assess him and make sure he was okay. We actually didn't have to use any medications, but yes, we will have that. However, what was very successful yesterday is that the LVN who works at the RCFE on the day shift yesterday was actually stationed in the observation area so that our team for John Muir could be concentrated on administering the vaccines. So we would ask that the clinician that's on site be in the observation area during the day to help us as eyes on patients, especially since those LVNs at the RCFEs should know these patients really well. I hope that answers that question.
Thank you. And just to clarify, for these facilities, they're residents. It's not a medical facility. So these are residents. You know, I know that patient model, but I want to confirm that it's really residents. And there's really kind of some confusion. This might be Dr. Levin. Dr. Levin, if you could answer this before you drop off, of sort of how does this fit in with the pharmacy partnership, or is this a time at which these facilities need to sort of pick which train they're getting on? Are they going to go with the pharmacy partnership? Is this more of a cleanup? How should they be viewing this?
Sure, yeah, and I'm happy to say this got clarified yesterday with the state and with the pharmacy program that this is not an either or. You can go, so you should definitely go with whoever's coming to you first, but if we know we're not going to capture everybody. There's going to be people that don't come in, they're on the night shift, they miss it, so when the pharmacy program comes along and say, we could do this for you too, then you can capture all those people who got missed the first time. Or if John Muir ends up being later in terms of their schedule, go with the pharmacy, but we will still offer it from John Muir. The only stipulation is that if you get your first dose with the John Muir team, you got to get your second dose with them. If you get your first dose with the pharmacy program, you got to get your second dose with them. And that's for vaccine consistency.
I feel like the old saying, dance with the girl who brought you, is just so appropriate for this time. Who is the first person who calls you and says, we're ready to schedule? That is likely the sort of organization you should go with to get it done as quickly as possible. So how should they handle residents who they're in conversation right now and they're setting their move-in date, but they're not yet in the building? How should they handle those vaccinations?
I'm sorry, was that for residents that are planning to move in?
Yeah, they're in conversation. Probably the family's been here over the holiday. They've agreed on this facility. They're just setting the move-in date and they're not sure if it's going to be before or after their vaccine clinics. how should those facilities handle those vaccination? Or let's say that they move in after their vaccine clinics, how can they work with that resident to ensure that they do receive the vaccination?
So yesterday, there were about 24 residents that were planning to move in January 1st, right? Or maybe on Monday. And we extended the vaccine to those who were already confirmed. They've put down their down payment, they had a move-in date, and it was extended out to them. It was offered.
Great. And so I think, we see some questions here like when are we going to get this question around dementia consent resolved? And what I would maybe just say is I think Judy and Crystal and the legal team are going to convene, and I expect that we'll have an answer early next week. I think what we've heard from CDSS is it's, verbal consent, and the folks know who has capacity and who doesn't. And so the facilities really is quite skilled at getting that process approved for care. And I think this is just continuing in that good way of being careful and ensuring the residents' rights are protected. And so another question of how are you going to handle buildings where there's an assisted living component and then there's the memory care? How is that going to work?
So we've talked about this a little bit with our teams. First, we are encouraging the consent for all patients, including those in the memory care, right? So we do need to make sure that that bridge is crossed first, but we need to build that bridge. So what we want to do is just make sure that they have their consent signed by their the person who's doing their consent, and we also we probably plan what we would envision is that at the end of the day, we would take a team of 2 or 3 nurses into the memory care and do all of the vaccines within the memory care at that time at the end of the day. Yesterday, there were a couple quarantined residents that we actually had nurses deploy out to their rooms or their apartments where they did the vaccines there. It's not ideal. We had so many people to help us yesterday that we had enough nurses that we were able to do that. So with the memory care, we do want to make sure that we approach that appropriately. It's kind of what we did when we were doing COVID swabbing. We sent a team into the memory care and it worked out really well. But those residents that are quarantined in their apartments, what we're going to probably do for those is also save them for the end of the day and actually bring them into the vaccine clinic or bring them into our space.
I also just want to add that Choice in Aging is graciously working on some trainings for folks who are doing these vaccine clinics so that they can know what all of you facility workers know, which is how do you work with someone who experiences dementia, who might be agitated? You deal with that on a daily basis, and they will we'll be working with them to make sure that they come into your space well armed with information as well as with the vaccine. So Crystal or Judy, don't know who this should go to, but these facilities are almost like casinos for my home state in that they operate 24 hours a day, and they have staff that only work on the weekends or only work evenings. How does that fit in with the vaccine clinics? Will these only be offered Monday through Friday, 9 to 5, or will there some other flexibility in scheduling?
There will not be flexibility in scheduling on the weekend. It will be Monday through Friday. It may even be only 3 days a week. It may be Tuesday through Thursday. We have enlisted our physicians that are within our residency program to help, and they are mostly available on Tuesday, Wednesday, and Thursday. So there still are some questions that are unanswered, but bottom line is we will not be able to offer this on Saturday or Sunday. But as Sarah Levin, she's probably gone already, but the county is putting together the availability for the clinicians or the staff members within these communities to receive the vaccine through the county is always an option.
Yeah. So, some of these facilities, their staff work at multiple locations, maybe with inside the same corporate structure or even outside. How should they handle those staff members? So if they have a staff member A that works at their building and they sign up to work with John Muir, should that staff member be vaccinated exclusively at their building, even if their second job starts to have a vaccine clinic as well?
Oh, I think we just need to, they need to pick one facility and go through that program.
Mhm. Okay. And so if they have a staff member who's recently test positive but has been cleared to go back to work, are they eligible for the vaccine? And is that addressed anywhere in the registration system?
It is addressed in the in the pre-screening questions that we do on the day of the vaccine. Anyone who has had COVID previously and is out of their isolation is feeling well. Their symptoms are improving. If it's day 11 after their symptoms started, they are entitled to receive the vaccine. A couple other questions that have come up, especially are for the resident population, is when the administration of their flu vaccine was or their shingles vaccine was. We have to make sure that we are asking those questions, and we do a pretty thorough screening process when we are just about to administer the vaccine. We go over that screening questionnaire. We turned away a few residents and a few staff yesterday. So for instance, the shingles vaccine, you don't want to get the COVID vaccine unless it's been at least 28 days.
So I just want to remind everyone, if you have any questions, feel free to drop them in the chat or the Q&A. We're doing our best to get those. Some of the questions we're still working out about how independent living or unpaid caregivers fit in there. Know that we will do our best to reach consensus and understanding as soon as possible, and we will reach back out to you with those answers. As Crystal said so well, we are building the plane and flying at the same time, and sometimes answers change quickly, but the intent through the county and John Muir is to expedite the vaccines to the residential care facility for the elderly, and they're working a variety of venues and opportunities to get that completed. You were selected because again, you've worked in the facilities industry a long time, you have larger facilities, you have memory care, and we think it's really important that your facilities are completed quickly. So I want to open it up to more questions. And also, Crystal and Judy, do you have any additional information that facilities should have as they're trying to make good decisions?
I don't have anything at this point. I think once Crystal and I have a chance to connect, I'll probably put together some information that we'll get back out to you. But Crystal.
I do see a couple of questions in here about independent living. So if you do have independent living residents at your RCFE and you're on this call, they will be included. Like I said, as long as everyone is registered, they will have an opportunity to receive a vaccine. Also, the question about family caregivers. So they will be included as long as they are identified by the facility as a family caregiver, whether it's an independent living resident or assisted living facility resident, they just have to be registered. But we wish we could give this vaccine to everyone's husband or wife or cousin or daughter, but it really is for those people who are going to be in your building on a regular basis that need to receive this vaccine.
So I know that a lot of facilities need time to think, talk to their corporate office, but I did want to add, if you feel like you know now that you'd like to participate, we're going to have Chelsea from Choice and Aging drop her email in the chat. And so if you are interested in moving forward, you will want to email her your facility name, your name and role at the facility, and the name of the facility, your official license name, not just what you sometimes go by, but your actual license name of the facility. And that way will allow us to keep a clean spreadsheet of interest so we can share that with John Muir. So Chelsea's email is in the chat, and her email is cvelez, CVELEZ @choiceandaging.org. So again, you would email her information, say, this is our facility name, this is my name and my role, and yes, we want to move forward. And in that email, if you could please include how many residents you currently have at your facility and how many staff are currently working at your facility. We have a question, and this has come up around some of the pharmacy partnerships of, what if a resident doesn't have a new Medicare ID? Does this require the Medicare ID or a social security number?
No, it's not part of the registration.
Excellent, it's good to hear. And will the clinic be managing the federal documentation necessary related to the vaccine administration?
So the good news about using this software is it takes all the information that we've collected and regarding the administration of the vaccine and sends it directly to the database. So it makes it very, very, very easy for us at John Muir to do that, no extra work. So that all gets bundled up once we're done with the clinic and off to the state.
And just a reminder, Chelsea's email is cvelez @choiceandaging.org, and it is in the chat.
One thing I want to share is that we do encourage you to start letting your residents and staff be aware that this is coming. It's coming in the next couple weeks. If they have any questions, we highly suggest that they talk to their PCPs first, get any questions answered with their PCPs so they feel comfortable about this. We also suggest that you highlight vaccine clothing when they come to the clinic to make sure that their arms are easily accessible for us, so they don't have to disrobe too much, but maybe a tank top or a short sleeve shirt underneath their sweater or jacket. Just little things that we are starting to figure out from yesterday's experience. Also, we had a couple of news media outlets show up yesterday. If we do not, if you feel the need that you need the news or you're inviting the news out, please let us know ahead of time so that we are prepared. Yesterday we heard one was going to be there, and we actually had 5 show up, and it just was kind of a nuisance to the the flow of residents coming through the registration in the clinic and out. They just took up a lot of room.
Absolutely. I want to encourage everyone to drop your questions again in the chat or the Q&A. This is a great opportunity to take advantage of the folks we have here to answer all your burning questions. And again, I also know this requires some time for reflection, so we understand that as well. I also would say there's been questions about, okay, if they're moving in January, but what if a resident's moving in after that? We can't answer every question. There's a lot of variables we can't know. What I will say is what I said before, is that the county is working multiple angles to ensure anyone in congregate care settings receive the vaccination. I don't think that this will be the last time for someone to get vaccinated, but again, things are still developing. So just know you'll need to stay tuned and stay aware of what is happening. So how will you be sent the registration form? So you'll need to email Chelsea, as we said, indicating you'd like to be a part of this program. And there's a question.
There's a question from Denise about John Muir doing clinics in other Northern California counties. Unfortunately, no. We have been assigned 22 buildings in Contra Costa. This is our home, and this is where we are helping.
Excellent. So I just want to thank everyone who participated today. We know that this is a changing time. So we have recorded this session and we will be doing another session this afternoon for folks who couldn't participate this morning. We'll be sending out those recordings to all of you who were invited to participate and those that registered, so you can go back over this and make sure it's within your capabilities. We welcome any additional questions. You can send them to us and we will do our best to get you the answers. We hope this has been interesting for you today. And I just want to give Crystal and Judy a chance to give any final comments.
I have one final comment there in the Q&A. There's a question from Kevin. It says, do you want residents and staff to come to the clinic in the order they were registered? No, but we will go over the registration or the time slot process for you, depending on how many nurses we have on hand, how many physicians. That will determine how many vaccine clinics we will have. And what we typically do is, how many stations. So if we have 4 stations, we would ask that 4 people be registered every 10 minutes. So we're hoping that we can have more vaccine stations. If you have any clinical licensed staff that are willing to help administer vaccines with us, that would help as well. I know that there are RNs and LVNs, even MAs can give vaccines as well. So if we can all do a training at the very beginning of the day and everyone can pitch in and help make this go quickly. We were at a small community yesterday. So 162 vaccines took 6 hours. That was with 5 vaccine stations. And that was both staff and residents. I know that some of you have communities as large as 150 residents. So I imagine that might be 320 vaccines with all of the private caregivers and the staff and the family caregivers that would be involved as well. So that's a long day. The more help we have, the better off we will be from a time standpoint. But so to answer your question, Kevin, they don't have to come in the order they were registered, but we will help you develop your schedule and the timing.
And we do that in the application. We create once we know the clinic date and the hours that we're going to be there. As Crystal said, if we have 5 stations, we can figure out how far apart. We create 5 10 o'clock slots and we book accordingly. So it makes it very easy to keep track of who's coming and going when.
So
and the other question about staggering residents and staff. Yesterday, we had to register staff and residents outside because it was cold. We did have the staff first, and then the residents came in starting at about 9:30, so that the residents who are it was a senior community. We just wanted to make sure that they weren't too cold. So that was one approach, but it can be different. At whatever serves you best is what we're going to help you work through.
If they do, you had to queue up outside, which I'm sure is not ideal for anyone. It's a little chilly. Should they start to plan to have some awnings and some, warming, whatever, like space heaters? Should they start to plan for that on the day of the clinic so that knowing that they'll need more space to queue people up? Crystal, you're on mute still. I'm sorry.
I know. Sorry about that. I start thinking about a room that would be big enough to accommodate 4, 5, 6 or more vaccine stations, where residents and staff can line up and maintain social distancing. We will want a registration table outside of where the vaccine clinic will be, and then we will want them to go into an observation area that will have to be larger than the vaccine clinic, because they will be waiting there for longer than it took them to have their vaccine. So at the RCFE we're at yesterday, we had to put the queue outside because of space. They did have a large fire pit outside that they were able to turn on for people who were filling out their screening and their consent. So yes, please start thinking about it. If you do have any heaters that you can put outside, if it needs to be outside, then that would be great. But like I said, part of this process we also want to do is some kind of review of your the actual physical plant, so that we can help you best plan how to line people up, where the clinic will be, and where the observation space will be as well.
That was great, Crystal. Thank you. I think some of the question is around staggering and keeping with the guidance from CDSS to vaccinate half their staff and half their residents during the first clinic, and then the remaining during the second and third clinic. And so I think the question is, will you, John Muir, be dividing them into lists? Would it be the facility's responsibility to complete that? How can they ensure that they're following that guidance?
I don't have an answer to that question. Judy, do you? I mean, what we are hoping, because of our limited staff and our limited time, that we only have 2 dates, and that we get all of the residents and staff on the first date, and then for their second dose on the second.
Yeah, I would agree, Crystal. That's the guidance that we've had so far.
I'm sorry, to clarify, are you saying you plan on only doing 2 clinics per facility?
That is correct.
I think we might need to talk about that further, because they have been instructed to split the clinics to ensure that the staffing is not an issue. And so that might be something we need to talk about. The last question is, how many days or how much time in advance do you anticipate being able to give to the clinics? You know, they're hearing that some of the pharmacies are only giving 48 hours. Does John Muir plan on having maybe a little bit longer time than that? About the same? What are your thoughts?
Do you mean for preparation?
Yeah.
So Monday at 4 o'clock, we knew that we were doing our pilot. We told the facility at 4:30. They got their line list to us by 1 o'clock on Tuesday, and we were there administering vaccines at 8 o'clock on Wednesday. I'm hoping that we have more preparation time for each facility, but I don't know if I can promise that. So 48 hours does seem like a fair amount of time if the right members of our team are helping the right members of the RCFE. And if we can give you more time, I will try my best to do so.
And I think actually everybody is starting with a jump start on the facility we did yesterday, because they had no even inkling that was coming. So they did an amazing job to help us get prepared and get their residents prepared, and actually went very well.
All right, well, seeing no more questions, I think we'll go ahead and close. Again, I want to say thank you very much to everyone. We appreciate all of your good work. And if you are interested, please email Chelsea and we will be in further contact shortly. So I wish everyone a very happy new year.